Thank you very much. Good afternoon. Are we afternoon? Sorry. So myself and Ffion, we're going to share information and the ongoing success of the North Wales Memory Support Pathway. Oh, it's gone there. North Wales Memory Support Pathway. And this is commissioned by the Health Board, the 6 North Wales local authorities and the Regional Partnership Board. And the partners delivering are the Alzheimer Society, Carers Trust, NEWCIS and the Carers Outreach Service. So we are known collectively as the Memory Support Pathway rather than our individual organisational names. We work together and seamlessly to make sure people in North Wales who are affected by memory loss receive the right support at the right time. We support anyone who's worried about their memory, who have been given a diagnosis of dementia, or as a carer, relative or friend. Our aim is to support people as early as possible and ensure that people affected with dementia receive the help when they need it the most. So let me explain to you how the Memory Support Pathway works, and I'll explain to you how it was explained to me. So imagine a person has been given a diagnosis of dementia or is concerned about their memory. Their journey can be confusing, frustrating, lonely, and stressful. The Memory Support Pathway aims to provide the stepping stones to support that person through their journey. So they start at point A, at the beginning of their journey, which is uncertain, full of questions and concerns. And we are there as long as they need us, guiding them until they reach point B, where support no longer is needed. There should never be a time when that person or their loved one doesn't know where to get help or support. The Alzheimer Society will provide pre- and post-diagnosis support, and the majority of the referrals come from the memory services and GPs. However, a small number of self-referrals and referrals from other organisations are received. To support with navigation and identification, we have the expertise of NEWCIS and the Carers Outreach. They receive referrals only from hospital settings. We also have dementia centres in every county, operating an open door policy, and these are run by the Carers Trust. So this slide was written by someone with dementia who has been through the pathway. It shows 2 people, bottom left, one of whom has received the diagnosis of dementia. Prior to the Memory Support Pathway, they would have been given information from many different sources and from many different directions, making it confusing, frustrating, daunting. The larger part of the circle is the Memory Support Pathway. This is where information and assistance can be received, such as support with their journey, care, finances, and health. It also shows referral routes. In the middle is the long-term support offered by the dementia centres. So you recall I mentioned stepping stones in the pathway. So I'll talk to you, and Ffion will, about the support for people in the pathway with dementia and their carers. When someone is worried about their memory, they'll speak to their GP. The GP will undertake some initial tests and, if appropriate, refer onto the memory clinic, who will carry out an assessment and refer onto the Memory Support Pathway. It's important to remember that referrals can be made to the pathway prior to a person having a diagnosis. This can be critical to prevent crisis, provide information about memory loss, and to support to provide information about remaining healthy and active. Once the referral has been received, the Alzheimer Society will make contact and offer help and support. This support can vary depending on the person and is client-led, either by a phone call or face-to-face. The dementia advisor will listen to what's needed and take a holistic approach. This initial action is just so valuable and comprehensive. These initial visits are not rushed, and time is taken to really understand the person with dementia and their carer. I have been fortunate enough to observe these visits, and you can visibly see the relief when someone's offered help and support. The assessment or conversation is led by the individual and their carers, and it can provide lots of information and talk about concerns a person may have. This can include information about their diagnosis, information about legal matters such as lasting power of attorney, talk about benefits. People can discuss how to remain independent and plan for their long and short-term future. There are discussions around keeping healthy, such as being physically active, maintaining a healthy weight, being socially and mentally active too. In 2023, last year, the Alzheimer Society supported 1,277 people. 807 were people with dementia, 470 were carers, and 110 of the people with dementia were under 55. Oh, sorry, I didn't skip the slide there. There we go. So this is the team which provides pre and post-diagnosis support. It's made up of 2 managers, Kerry and Janet, and 10 dementia advisors. We also have Bethan, who is here with us today, and she is a service user engagement officer. And her role is to establish innovative ways of engaging people with dementia to come involved, to share their experiences, to empower them to become a force for change, both locally and nationally. And then there's myself. I'm a community development coordinator, and my role is to ensure that everyone is aware of the memory support pathway, to attend events and to talk to people like yourselves. So NEWCIS and the Carers Outreach, who are here today as well, are part of the pathway which provides support for people in hospital throughout their stay. This is delivered by hospital navigators in each of the 3 acute hospitals in North Wales. They listen to carers and identify what support is in place and talk to them about the memory support pathway. If the patient or carer is aware or known to the pathway, they'll be reminded of the service and offer by the Dementia Centers and the Alzheimer Society. The hospital navigators receive the daily referrals from hospital ward rounds and able to support the person with memory loss or dementia and their carer right from admission to discharge. This service supports the person and the carer during the inpatient stay and the support with communication and with discharge planning. Through having conversations, the navigators are able to talk to the carer about the support which is available to them, refer them onto the memory support pathway to access the Dementia Centre and that of the dementia advisors. They can offer carers' needs assessments and information on respite services and small grants to support the carers. They can talk to the carer about how to look after their own well-being and signpost to services available within the community to support them in their caring role. This is extremely valuable service within the hospital setting, and it should be noted the navigators are able to support anyone with memory loss and their carer, no matter reason for their admission. This is the team of hospital navigators. As you can see, they're located in all the acute hospitals in North Wales. I'll now hand over to Ffion.
Hello. So I'm Ffion Travis. I work for Carers Trust, and I'm fairly new in post, even though you might know me before because I was a coordinator for the Dementia Centers in Gwynedd. I am now the project lead for the Dementia Centers. I'm the new Gwenor Davis, if anybody knows Gwenor, because everybody knows Gwenor Davis. I've taken on her role and trying to fill her extremely large shoes. I was going to do this in Welsh, but I know that there is some problems, I believe, with the translation. So bear with me. I'm now doing it in English. So, as you can see on the screen here, sort of like the Dementia Centres offer support for those who are worried about their memory and their cognitive health. So we are very open. We have we are not bound by any boundaries or anything. Anybody can come over to see us if they are worried about their memory, or if they have had a diagnosis, or if they live in South Wales and they've come over to Anglesey for a holiday. You know, they can just pop in and see us if they feel that they need that support. You know, the kettle is always on with a packet of biscuits as well, which is always helpful. The Dementia Centres provide support for people living with dementia. So we have weekly groups. We have different things. We have got taith groups. We've got Cynion. We've got exercise groups that are going on. We are wellbeing services. So we offer, you know, we're offering the hearing test with the audiology, the chiropody, the simple dental checks, just to see how things are. You know, if the dentures are rubbing or anything like that, or if anything's going on, you know, it's so simple. You know, it might be going to a dentist and being in that sort of room, or sort of in the waiting room, or something's happening and trying to find parking. we can offer people these services in our centres so that they can feel at home, that they don't need to be rushed or in that sort of waiting room environment. They can be with their loved ones, and also we can support them as well. Hairdressing as well. Some people, got 5 minutes. Better be quick. So there's hairdressing as well, and well-being. So, you know, nails and things. Everybody needs to sort of feel good about themselves. So if we can have it in our centres, then it's brilliant, isn't it? A programme of support services within the centres include information sessions, informal chats, peer support groups, male carer groups. We've got female carer groups, bereavement groups. So Cadwaladr. Now that is for, again, people, you know, like Mary was talking about, sort of feeling that loss of somebody when they've gone to possibly a residential care home, or, you know, when they eventually pass away, you know, sort of, we will be there sort of, and we feel that people's grief doesn't stop after a few weeks or anything like that. It's such a loss that we carry on going with these groups called Cadwaladr, Our Loss. We've got sort of the young onset clubs. We have got one in Wrexham, but we are starting one up in Anglesey as well. We are always striving to have different groups and groups that will support people and how they feel that they need to be supported. You know, we are collaborating with people as well. So last week we were with Aurora Co-op. Hello, Aurora Co-op. Fantastic group that came to us. She sort of Gwenda, if nobody knows what Aurora Co-op is, Cefnogi, they are based within Gwynedd and Anglesey, and they are supporting people within their own homes, sort of like a befriending service. But they also do these fantastic afternoon teas and entertainments. They've done sort of walks down the pier and things like that to raise money and awareness. But we had one in our centres last week, and it turned out to be fantastic. Everybody absolutely loved it. We had Dylan and Neil coming over to have a singing and entertaining us with a lovely afternoon tea, and also with the Google bikes and reminiscence as well. And it just was wonderful. So we are also working alongside with other people as well. I know in Wrexham that we've got a multi-generational group that is starting. So there is a lady that has organised that children are coming over to the group, and they'll be doing some crafts and things together, which is just lovely. We also have Dancy Baub that hopefully come in to see us in May as well, to do different groups within the centres within Gwynedd and Anglesey. So we are doing quite a lot of groups, and we're always changing. Now, across here, you can see sort of where our centres are. It's not the best map. It hasn't got these pins to say where it is, but it's what we've got. But you can see here where, this is the Welsh one. We've also got an English one here. It also says sort of where all the coordinators are. We've got a couple of satellite hubs as well. And we have, you know, sort of, we are right across North Wales there. So, you know, like I say, it's not boundary led, so we can all go to any of the centres really, which is really brilliant. Now, sort of like going, this is the last slide. You'll be glad to hear. Oh, I just lost my spot. So, to recap, this centre is for anybody and everybody. We don't need a referral. Anybody can walk in. If you want the support, even from the very beginning to the very end, we can still give you that support, advice, and just have a cup of tea and a chat. We have got a couple of quotes here that I thought I would just share with you, just to let you know what other people think that have used the service. The dementia advisor was helpful and very informative and very nice. They sent lots of information and also told us about Cadwaladr. We went for the first time and everybody was so nice and learnt so much. I feel more confident, and I know I have somebody to rely on. I can phone when I need to. I cope well at the moment, but it's good to know that there is somebody there when I need them. I know that people have said so many different wonderful things, but those are just two. And I think that's the end of it. Thank you very much. Diolch yn fawr.